Okay, this is Brother Wolf. This is HS 375. Tonight's group will be talking to us about managing long-term care facilities. And I am going to turn it over to them, and I believe Jordan's going to start first whenever you're ready.
All right. Good evening. Welcome to our presentation on managing long-term care facilities presented by Group 3, Lexus Allen, Emily Bell, Jordan Larson, Heather Morgan, Gretchen Reese, Lindsay Torgensen, Rebecca Turner, and Tiffany Wright. Next slide, please. The history of long-term care quite literally is a thread woven into the fabric of our history and continues to be a subject of great importance in a day and age in which more and more seek the benefits of such services. Long-term care itself describes care provided for people who need assistance or care on a long-term basis. Long-term care is often provided for people with chronic illness, physical or mental disabilities, or problems with activities of daily living, all of which generally lead to the need for lifelong assistance only once they occur. In some states, some long-term care services may be covered under Medicaid. Medicare generally does not cover the cost of non-acute long-term care services. Next slide. The United States in the 1700s was predominantly comprised of young people for a variety of reasons. Life expectancies were much shorter as they are today, primarily because so many people died in infancy or childhood. That meant that a relatively small percentage of the population lived to old age. If a parent needed care, the children were expected to provide it. Elderly people in need of care who were childless but wealthy could hire whatever help they needed. Poorhouses became the homes for the elderly. The public welfare system of the 18th and 19th centuries was a local, not federal, obligation. In the 1800s, more and more children had to leave the family home in order to make a living. The westward migration of the country contributed to the dispersation of families. Conditions in the poorhouse ranged from barely tolerable to horrific. The operators often did as little as they could to get away with in exchange for a paycheck, and the governing bodies often did as little as possible. In response to the problems of the poorhouses, numerous nonprofit organizations began building old age homes to give responsible poor people a way to avoid the poorhouses. Nursing began to emerge as a profession in the late 19th century, along with professional home health care. As trained nurses became available, wealthier families sometimes hired them as live-in providers for the elderly. Next slide, please. In the early 1900s, the number of people living to old age and the number of years they spent in old age continued to increase. The average life expectancy of birth increased by 10 years from 1900s to the 1930s and increased again by another 15 years from the 1930s to the 1990s. This change occurred largely because fewer people were dying in childhood, so larger percentages of the population lived to old age. While the professional nurses and nurse training schools had originally emerged to serve the hospitals, there was a growing demand for nurses to care for the sick in their own homes, either as private duty nurses who were paid directly by the family to care for the elderly. In the 1930s, the Great Depression changed everything. The problem hit the elderly particularly hard. Those who were retired or close to it watched a lifetime of savings disappear, and they weren't well enough to work or couldn't find the jobs that could allow them to rebuild their lost investments. That many of the elderly completely depended on their families, but hard times for younger family members often meant little or nothing left to provide for their parents. Hard times generated new waves of migration. Unemployment workers crossed the country to search for jobs, further dispersing families. Older family members who had no income of their own were more likely to end up in the poorhouse or independent or dependent on charity. Next slide, please. During World War II, many seniors came out of retirement to help with the war effort. Their employment income probably kept many of them off the welfare rolls during the war, but they had to retire once again when the servicemen returned home and needed jobs. The war also added to the size of the disabled population who needed long-term care. The size of the elderly and disabled population was growing. In the 50s, states create nursing home licensing. Nursing homes were emerging all over the country, but there were no federal standards for their design or operation. They were not licensed buildings, they were unsafe, and there were allegations of abuse and neglect, and nursing care was sometimes non-existent. The 1950 amendment for the first time demanded that states that received federal matching funds must create systems to license both nursing homes and hospitals. Various studies in the 1950s found out about half of the residents in private nursing homes were public assistance recipients, and that the federal, state, and local governments were paying about half of the total cost of all the nursing home care in the country. Next slide, please. The demand for the nursing home beds increased. Even with all the new construction, there seemed to be an unquenchable shortage of beds. No matter how many beds were built, there will always seem to be people available to fill those up. Nursing home quality concerns escalate. Questions about nursing home quality continue to dominate. By the 1960s, a U.S. Senate Special Committee on Aging report said that 44% of nursing home beds failed to meet fire and health standards. This should not have been surprising because few had been held to those standards or any standards when they were built. Long-term care and current healthcare system. The long-term care is is the problem everyone worries about. How do we pay for it without busting the bank for the taxpayers or placing an intolerable burden on the backs of individuals and families? The need for the extended care has become a reality through the longevity revolution. Millions of people are living longer and longer, reaching an advanced age, yet the healthcare system isn't designed to cope with long-term care issues. These challenges will be exacerbated as the population ages. The baby boom generation has begun to retire, and the number of people aged 85 and older, those most likely to require long-term care, will double by 2020. Policy, regulation, and safety continue to be major factors in the ongoing long-term care dialogue. Long-term care truly is a thread woven in the fabric of our history and continues to be a subject of great importance in the day-to-day age in which more and more people seek to benefit such services. Next slide, please.
I believe Lex's information. Maybe we can skip it and come back to it later if she shows up.
The National Professional Advocacy and Organizations, there's several of them throughout the United States, some of which we've learned about in our class, and I'm sure we'll continue to learn about some of these. There's so many to name, but there's all of the American assisted living, nurses, there's long-term, they're all just long-term cares. Next slide, please. Here are some additional long-term cares. Like I said, there's just several throughout the United States and national-wide. Next slide, please.
This one's mine. Can everyone hear me? Okay. So the different levels of long-term care that I found before we learned the different levels last week. So they overlap a little bit. The first one is home care, which is the first level that we learned about last week as well. It makes up the largest portion of long-term care. It can be by professionals or family members. And then there's community services, which fit into level 1, I believe, of long-term care, but it isn't its own separate thing. It kind of overlaps. It includes things like adult daycare and meal programs, the stuff that we talked about with the Older American Act and the services that are covered by them. Next slide, please. So supportive housing programs are not really in any of the levels of long-term care that we talked about, but they're a sort of subsidized housing for older people who can't afford the full cost of living on their own. But it doesn't provide any health care or anything. It's just a place to stay. Assisted living is the second level of long-term care, and it has a lot more assistance. It provides meals and some healthcare services, but mostly it's a place to stay. It's not quite as extensive as nursing homes. Next slide, please. So continuing care retirement communities are places that provide basically levels of long-term care within just one facility. So it just makes it easier for the people, so they don't have to move to a different location if their care becomes more involved. And nursing homes are just a little bit more intensive of care than assisted living. You have nurses that are on call 24/7, hence why it's called a nursing home. And it also provides accommodations with activities of daily living. There are, in all of these places, you don't have to be an elderly person necessarily to live there, but it's mostly elderly. Next slide. Oh wait, no, never mind. Intermediate care facilities, I'm sorry, are just for the mentally ill or mentally retarded. So it's an optional Medicaid benefit that it requires you to have an active treatment for intellectual disabilities and other related conditions. It's kind of an add-on to any of the other facilities. It's not necessarily its own separate thing. And that's the end of my slide.
Okay, costs. How will you pay for the long-term care of your loved one or perhaps your own long-term care? Although costs can differ based on many different factors, here are some numbers that will give us an idea of the average cost in the United States, and these are as of 2010. So just over $6,000 per month for a semi-private room in a nursing home, almost $7,000 per month for a private room in a nursing home, just over $3,000 per month for care in an assisted living facility, and that's for one bedroom unit. $21 per hour for a home health aide, $19 per hour for homemaker services, and $67 per day for services in an adult day health care center. Next slide, please. So funding. 70% of 65-year-olds will need long-term care at some point in their lives. So how do you pay for it? There are basically 4 options when paying for long-term care. You can pay out of pocket, and they say a person will generally need at least a few $100,000 to cover that. There's long-term care insurance, which pays a specific daily amount for a specific number of days, or in some cases for the policyholder's lifetime. There's Medicaid that pays for a significant portion of long-term care. And there's also reverse mortgages, which are non-recourse loans, drawing on the equity of a person's home. And as we discussed previously, Medicare and private insurance pay for little or no long-term care, may cover some skilled nursing care, but limited to 100 days and must follow a hospitalization for the same condition. Next slide, please.
Okay, most, if not all of us in this class are planning on pursuing managerial positions in healthcare. It is important for us to know what challenges we might face. I'm going to talk about some of the challenges that can come when dealing with long-term care. One potential challenge we face is that the elderly population is ever growing, and due to modern technology, people are living longer. When baby boomers started retiring in 2010, This was the start of a never-before-seen growth in the 65-plus population. By 2050, it is projected that the elderly will account for 20% of our nation's population. Currently, it makes up about 14% of the population. Another potential challenge is with liability issues. Every job out there has potential liability issues, but with long-term care, these challenges are unique. Abuse and neglect of the elderly come into play, as well as non-compliance with state and federal mandates. The good news, according to a 2013 report, is that the frequency of these types of claims has not increased. It hasn't decreased either, but holding steady is better than seeing more liability claims. The bad news is that the claims that are filed are becoming more severe, and the dollar amount of the claims has increased. Next slide, please. Okay, as for revenue and financial issues, long-term care is tricky because, as we have learned, Medicare doesn't pay for long-term care. Medicaid does help with costs, but they are not always quick to pay, and when government dollars are tied into any type of payment, there can be problems. Unfortunately, only about 7% of current baby boomers are prepared for their long-term care needs. As administrators, we are responsible for the quality of care that goes on in our given facility. We must be skilled in leadership, communication, and marketing, which makes these positions much more than just managerial jobs. Long-term care is different from acute care. Acute care mostly worries about reaching specific healthcare outcomes. Long-term care deals with social and medical aspects of the patient. Also, communication with family members is vital when dealing with patients in long-term care. Many times, the patients can't make decisions for themselves, and family members have to be consulted. Next slide, please. Okay, the last point I want to touch on, which actually goes along with the first one regarding patient population, is the workforce shortage. Due to the growing number of patients needing long-term care, there seems to always be a shortage of qualified workers. There is a rapid turnover rate among healthcare workers due to it being a demanding but low-paying job. As administrators, we will most certainly face the challenge of keeping our staff happy and trying to minimize turnovers. Next slide.
Okay, what is the future of long-term care? Well, the future is bright because there's a lot of growth in long-term care. This chart illustrates that. If we look in 2008, we can see the total market value is about $231 billion, and then if you jump down to 2014, it's about $329 billion, and it just goes up every year. Next slide. The problem, while 2 out of every 5 Americans will need long-term care at some point in their lives, many can't afford it. The cost of nursing care or assisted living is expensive. Costs range from $50,000 to $70,000 a year, depending on the area and type of care that they receive. Next. And how many Americans have long-term care insurance? About less than 8% of Americans have it. And this chart kind of illustrates, again, the cost, and this data was compiled by some long-term care insurers. Next slide.
Very good. I'm assuming this was your last slide?
Yes.
Yes, very well done. Very nice. I'm gonna highlight some things that you guys covered. I think you covered just about everything. and I'm going to be pretty quick just because I have another group that I'm going to have present for another class. But I believe it was Jordan was telling us a little bit about kind of the payers, and it's important that you guys review not just your group but the whole class in preparation for the Module 4 exam. During this week, week 9, one of the activities is the issues in long-term care reimbursement. It's a slide presentation, about 33 slides. One of the more important slides, I think, is slide 8, where there's 2 pie charts, and it talks about the pie chart on the left really gets into the reimbursement, really who's paying for long-term care. And you guys correctly pointed out that Medicaid is the #1 payer by far. And I just wanted to give you some numbers. They're about 40%, and this is all from that slide, so you can review that slide as well. So Medicaid represents 40% of reimbursement. Medicare, though they don't directly pay for long-term care the way many of us think of it, and you guys appropriately pointed this out. I think Tiffany had that little box on the left of one of her slides where she was talking about how Medicare pays for long-term care when it's, immediately following an inpatient stay, and the long-term care is related to it. So an example of that might be like a stroke, for example, and then you're in long-term care for rehab, or something like that. So, but Medicare, so technically Medicare doesn't cover long-term care. What they cover is rehabilitation, really, from an acute inpatient stay. They just happen to be recovering in these what most of us know as long-term care facilities. So don't get hung up by that, because both statements are true. Medicare doesn't cover long-term care, but they do cover skilled nursing facilities, right, where some of this care occurs. So the #1 payer is Medicaid at about 40%. The #2 payer is Medicare, and they're about 23%. So just keep those numbers in mind. And then you also appropriately outlined the 4 levels of long-term care, home care being the first, assisted living being the second, nursing homes being the third, and SNFs, or SNF, skilled nursing facilities, being the fourth. And you also mentioned ADLs, activities of daily living. Keep in mind that those are the activities, depending on how many of those that need to be done, that kind of dictates the level of long-term care that's needed, right? So it would be important to know what an ADL is, activities of daily living, and then know, 4 or 5 of the common ones, right? And then you guys also mentioned the Older American Act. So that's an important concept in this module as well. Excellent job. I think you covered it. It covered it in a great way, and I think the class has what they'll need to be prepared. Any questions from any of you or comments? No.
No.
If one of you would be so kind as to post your slides. Now I know there's not necessarily a discussion board, but you'll notice in week 9 there's a student chat board, right? If you can post your slides in the student chat board and then just monitor that for the next couple of days, see if any of your classmates have questions or comments, and engage them in that discussion if that's the case. So great job, and then I'll post the recording there as well. Thank you very much.
Thank you.
Have a great night.
Good night.
Thank you.